Of recent, we've gotten a lot of cases of a condition known as Pcos, or polycystic ovarian syndrome. This is a condition which is on the increase. Some people, they usually come with issues to do with their menstrual cycles, where they get irregularities in menstrual cycles. You find someone, getting a period, they get a period this month, they skip the next month or the next 2-3 months, and then they get a period after, 3, 4, 6, or even after a year. Yeah, so there are women who are like that, and they come, they are reporting, "Doctor, my periods are very irregular. Doctor, I want to conceive." Usually that's what brings them to hospital, because they fail to conceive, but again, they have irregular periods. Yeah, so I want to talk about this condition. Many doctors diagnose it as hormonal imbalance out there, but hormonal imbalance is a group of conditions. It's like an umbrella which comprises a lot of hormonal issues. But one of the most common conditions is the polycystic ovarian syndrome. Poly means many, poly means many. Cystic ovaries, it's to do with the ovaries, meaning the ovaries are cystic. A cyst is a sac of fluid, these are small sacs of fluid which grow or which form within the ovaries. So they usually start as a follicle. A follicle is where a woman's egg grows, and follicles are found in the ovaries of a woman. Now, women who have polycystic ovaries, the would-be follicles don't grow to full potential. They don't grow to the level of ovulating or releasing an egg. Usually these ovaries start to grow many eggs, the polybit, the would-be eggs or follicles. So the term follicles and eggs are used them interchangeably, because in many people they mean the same. So these follicles, the ovaries try to develop many follicles, call them eggs, but at a certain point they stop growing. So even the eggs inside die, so they just remain sacs of fluid, which we call cysts. So these things are usually very many in a woman's ovary. Yeah, so the ovary becomes cystic, and in this case polycystic, because the sacs of fluids are many, so they are poly within the ovary. So this condition I usually relate it to a mango tree that would put on so many small mangoes, but you never get to eat a mango out of it. They all drop when they are small. They all drop when they are small. So you find a mango tree putting on so many small mangoes, but you don't eat a mango out of it. They all drop down. The mangoes drop down when they are still small. So women who have this condition, their ovaries are polycystic. It's as a result of the hormones not interacting in a balanced manner to allow the eggs or the follicles grow to full potential and then ovulate. So the ovaries are polycystic. Now, there is also another letter I've left out, the syndrome. So what makes it a syndrome? A syndrome means a group of symptoms that usually occur together. So you find someone having more than one symptoms or signs. So if you look at maybe 3 people, you find that these people have similar presentation. Maybe the periods are irregular, they have other features which they are presenting with, and all those are usually seen in this condition. So that way it becomes polycystic ovarian syndrome. So how does it present? Women who have this condition, it has, I would say it has a milder form and then a worse form, a severe form. So women who present with this condition usually have symptoms such as irregular menstrual periods or cycles. They tend to skip, the periods tend to skip. They get a period this month. Once the period comes, maybe after 2 months or 3 months, the flow at times is heavy and prolonged, or at times they just spot. They don't really get a flow, they don't get that bleeding which flows. They just spot for a number of days, or they can even spot for a month. No period, no actual period, but they are just spotting. Or they can get heavy bleeding and it continues for like 2 or 3 weeks, or no period at all, So such women have irregular menstrual cycles. Some people don't get a period in a year, or once a year. They get it like once a year after 6 months. And when it comes, they can not just spot. Then the other symptom or the other sign is failure to conceive. Like I mentioned, their ovaries don't really mature eggs. So in most cases, they don't ovulate. So if there is no ovulation, then there is not going to be an egg to fertilize. So such women are not going to conceive, or they are going to struggle to conceive. So this is a category who have this condition in a more severe form. They really struggle to conceive, or they don't conceive without help, Then such women also have other signs or signs on their bodies, and one of them is a sign of increased male hormone, which we call a condition known as hyperandrogenism. This comes with a range of signs. One of them is what we would call a male pattern hair distribution. So these women, you'll find them with a body hair pattern that you would see in males. One of them is, they grow beards, beard-like hairs, or sideburns. Some of them you see them very hairy. Some of them would, have hairs on their chests, and like a pattern you would see in males. Maybe to note, not every woman who has these hairs that they have this condition. No, but many women with this condition have that sort of hair pattern. So don't look at people and start pointing, hey, you have this. No, it's not always the case. So that's the other sign that they get. Then others grow, acne, pimples a lot. They usually grow pimples a lot. The pimples or the acne can even fill up, other parts of the body which are not the face. Then their hair becomes silky, and it can easily break. So some even tend to grow a bald, balding, a bald head. Then the other thing, some of them gets a bit muscular, they grow muscles. Then some of them put on weight, a lot of weight in a short period of time. So those are some of the presentations that these women with this condition come with. But the ones that have it in a milder form, or a mild form, these ones might not even show any signs, but in a way struggle a bit to conceive. Like they would continue to have regular regular menstrual cycles. They might not have these other features I've described, but in a way, they struggle to conceive. So what happens? Such women, much as they are getting regular menstrual cycles, but some of their menstrual cycles are anovulatory. They don't involve an egg. So at times they can, in a cycle, they might go through a cycle, but without having ovulated. So as long as a woman ovulates 8 or less times in a year, those are 8 or less cycles, such a woman is going to struggle to conceive. That category can conceive without help, but at times it takes them a bit longer. You know, it can take them more than a year, 2 years. I've seen one who conceived after 7 years, but they were struggling with this condition. Yeah, so those ones don't have the syndrome, but they just have the hormonal imbalance. Their ovaries are just polycystic. Yes, so in case you realize you have these symptoms or signs I've talked about, this is how we would go about your condition in case, you know, in the hospital. So one of the things we do is, first we do the baseline investigations. We do a scan. First we do a scan. We want to confirm. The scan can help us, you know, look at the ovaries. That way we are able to note that the ovaries are polycystic. That's on scan. Also the scan matters because some scans really, the quality is not good, but any good quality scan is able to pick up polycystic ovaries because they have a characteristic appearance, you know, you can't miss them. Yeah, so we do a scan. We usually prefer a transvaginal scan, the scan that goes, you know, via downstairs. There is a difference between transvaginal scan and the scan which is done via the abdomen. The transvaginal scan is a bit more clearer because it's closer to, once it's inserted down there, it's closer to the structures we want to see than, you know, the one which is done on the abdomen, via the abdomen, which, you know, has to go through the fat and all that to reach the structures we want to see, which are quite deep, you know. So would prefer a transvaginal scan. I'm not saying it's the only one that, you know, even the abdominal can be able, but the other one is better. Then the other tests we do are hormonal tests. That's a blood test, so we look at the hormones. Strangely, in many people, hormones come out very normal. Much as we say this condition is under hormonal imbalances, but in majority of women, you know, your results might come out very okay. Yeah. Then the other test we do is a fallopian tube test, the HSG test, because again, the reason why we would want to do all the tests is because we've realized that someone can have more than one issue or more than one cause to their infertility struggles. Yeah, so if you focus on just the polycystic bit, and then you miss out the issues to do with the fallopian tubes, then still you may not achieve, you know, the goal of treatment. Yeah, so we check the fallopian tubes to make sure they are patent, they are functional. Yeah, then the other test we do, we do a semen analysis for your partner to make sure that the sperm are of good quality. So once we've tackled all those areas, and maybe the only issue is the polycystic ovaries, then we offer the treatments. Unfortunately, there is no direct treatment to this condition, so it's a combination of of treatments that we advise or that we offer. One of them is a lifestyle change, to these ladies. One of the things we advised, if you're a bit overweight, we advise weight loss and dietary change. So a lot of women, just by losing 10% of their body weight, many of them are able to regain, normal function, what I would call normal function. Many of them are able to ovulate spontaneously and then also conceive spontaneously without needing other treatments. Then the other thing you can do is watch your diet, reduce carbohydrates, then take a lot of proteins, vegetables, drink a lot of water. Then the other thing you can do is what we call detox. Some people, some ladies, you might be slim, no need to lose weight. So detox and dietary change can help. I've seen a lady who before she had this condition in a very severe form, and for her she was slim, but she just did detox. Detox involves taking a lot of foods with vitamin A, vitamin C, vitamin E. So such foods can help to detox the body and help the body work at its optimal function. So for her, she managed to conceive without having to go through other fertility treatments. But one of the things we can do is prescribe supplements. Still, supplements in a way help to detox the body because they have all these vitamins and minerals which are necessary for the ovaries, and the eggs to develop well. So, and even help with the hormonal flow. Yeah, so we prescribe supplements, then advise on the lifestyle change, weight loss, diet, consume plenty of water, and so that way some people can conceive unaided. Then one of the treatments, the first line is to help the ovaries. Remember, when I was describing the ovaries, I said the eggs don't grow to full potential. Yeah, so we aid the ovaries to develop the eggs to full potential. So in other words, we prescribe hormonal drugs. Some are tablets, others are injections. Then we work on the cycle, so we try to follow the cycle. If the periods do not come, first thing we do is to induce a period. Then we prescribe these hormonal drugs which push the eggs or aid the eggs to grow, like 1, 2, 3, 4 eggs to grow. Then we monitor them with the scans as they are growing. Once they are mature, we trigger them to ovulate, Like if you find a mango ripe on a tree but it's not falling down, you can throw a stone at that mango, or you can climb the tree and you shake the tree. So once we've pushed like 3 or 2 or 4 eggs to grow, then we give we give a certain drug which makes sure or which ensures that the mangoes fall off a tree or the eggs are released. Yeah, so that way, once the eggs are released, then we tell this couple when to meet, and the meeting of a husband and wife, so that way they can conceive. There is a lady I remember, she had this condition, like her periods would come like once in a year. Even up to now, after she had children, she still has the same issue. But this lady had spent 7 years without conceiving, and she had seen a lot of, so many gynecologists. But when she came, we, realized that her condition was polycystic. Her areas were fine. So I remember we did this program, which I've just explained, where we prescribed tablets and injections, then monitored her eggs, then triggered ovulation. So it's called controlled ovarian stimulation with ovulation induction. So triggered ovulation, then told her, go meet your husband every day for this number of days. And the first time she got twins, a boy and a girl. Yeah, so those babies have now grown. I remember the second time when she wanted to conceive, did the same thing, and she conceived triplets, 2 girls and a boy. So from 2 pregnancies, she got 5 babies, 2 boys and 3 girls. Yeah, so that's one of the treatments we offer. Then sometimes you may find, through the investigations, you may find the lady has polycystic ovaries, but the man also has low sperm count, So such people, if the fallopian tubes are okay, can benefit from insemination, artificial insemination, what we call IUI, or intrauterine insemination. So this still follows the same program of us growing the eggs, 1, 2, 3, 4 eggs at the same time. Remember, if we grow more than 1 egg, there is a higher chance of, if there are, let's say 3 eggs are ovulated, induced to ovulate, there is a higher chance that one can get twins or even triplets. So many people ask, how can I get twins or triplets? So that way, instead of ovulating with 1 egg, you get them to ovulate with more than 1 egg, 2 or 3 or 4. Out of those, they can get 2, they can get 3, they can get even 4. So the lady, we take you through, this treatment where we follow you up, we follow your eggs, push them to grow, then trigger ovulation. But because your husband has low sperm count, and this also depends, because very, very low sperm counts, or if the sperm can be normal in terms of numbers, but you find they are not moving, they are immotile. So it also depends on levels of these sperm parameters. But if we have reasonable sperm parameters, then insemination can work. So what we do, once we've triggered ovulation, we time. Then your partner gives us his sperm. So that sperm, we concentrate it. We concentrate the good quality sperm from the bad ones. Then we use a small tube. And we inseminate the sperm, or we inject, or we deposit the sperm into the uterus, intrauterine. So we deposit the sperm into the uterus, and then the sperm continue into the fallopian tubes. By that time we've already, timed ovulation and all that. So the sperm continue and fertilize the eggs. So in other words, we cut short on the journey the sperm have to travel within the system, or we give the sperm a push so that they reach the eggs faster. Yeah, so that's called artificial insemination, or intrauterine insemination, or IUI. It's very common in animals, IUI. Or in animals, it's called artificial insemination. Yeah, but that sort of treatment is common in animals. Then, if we deploy those 2 treatments and they are not working, Then the other treatment we can offer is the IVF or in vitro fertilization. IVF simply means that the egg is fertilized outside the body. So what we do, we stimulate the ovaries to grow so many eggs, then we harvest the eggs out of your body. So the day we harvest those eggs, your husband or partner gives us his sperm. Then using a dish or a test tube, a glass tube, we put the eggs and the sperm in that tube. So that tube serves the duty of the fallopian tubes in your body or a woman's body. Then we incubate them. We put them in an incubator. Incubator acts to provide conditions your body would provide for the egg and the sperm to fertilize, like they do for chicken eggs also. So we leave them in the incubator. 24 hours later, they fertilize, make babies. So if let's say we harvested maybe 20 eggs, they all they may all fertilize, or you find some don't, some do. So we give you a report. That's 24 hours later. Then we leave them in the incubator to grow a bit, up to 3 to 5 days. Then we get small babies, small potential babies. You can't see them with your eyes, they are microscopic, but with machines, we can see them. So once we get those babies, they might be 10, they might be 5, they might be more than that. So depending on the eggs we got and how they fertilized. So after 3 or 5 days, we get small babies ready for transferring into the womb, like seeds ready for planting. Then at that point, we'll determine how many to transfer into the womb. So this is similar to planting beans or maize. Like if you go to plant beans or maize, if you have some sense, you don't put one seed in a hole. You put like 2 or 3, because again, it's not guaranteed that once you plant seeds, they are going to germinate. So you put like 2 or 3, such that if one doesn't, maybe 2. If you put 3, 2 will germinate. If 2 don't, maybe 1 will germinate. If at times all 3 can germinate, or 2, or not at all. Because once you put seeds in the soil, you as a farmer, you cease to have control over them. So this is similar to IVF. So we choose the best embryos, the best babies, 2 or 3. If the quality of those babies, the embryos, is not good, we can even put 6, we can put 8, because they are weak. Most of them don't stand a chance. So we put many. If they are good, we don't exceed 3. Then we put like 2 or 3. Or if you say, me, I want 1, we put 1. Because again, the decision is made between you and us. We advise, then we agree on how many to plant or to transfer back into the womb. So we pick like 2 or 3, transfer them into the womb. After 24 hours, after 14 days, that's 2 weeks, we do a pregnancy test, which can turn out positive or negative, So IVF is not guaranteed. It's not guaranteed that once you plant seeds, they will germinate. So that's how it works, So, but once it fails, it doesn't mean that it will never work again. So we repeat until we get the results we need. At times, if we make many babies or embryos, we pick like 2. We transfer some. So the ones that remain behind, we freeze them. We keep them in the lab for the future, you get? So in case, let's say you've conceived first time with twins, you can come back once you've delivered, after a year, or 2 years, or 3 years, at times 5 years, you can come back and we get from what we kept, and we transfer like 2. Yeah, so that's how IVF works. So those are some of the treatments we can offer for women who have if you have this condition, the polycystic ovarian syndrome or that hormonal imbalance.